You know how I be telling y'all that I'm gonna give you the tea on travel therapy? Well, I'm gonna go into the cons of travel. Let's get into it. One of the biggest reservations that my providers will have, and also some of the realities once they do get into travel, are around whether or not they're gonna get work like a dog. There are some clinics that will see a traveler as a contractor that they can just use and abuse. We like to avoid those clinics at all costs because we want our providers to have a positive experience. I'm like, big sis, okay? I will fight for you any day, all day. You just gotta tell me. Con number two. It can be really annoying having to buy new clothes every 3 months for a new assignment because the company wants you to wear a certain color. We will always reimburse that. Number three. So doing travel is awesome because you can take as much time as you want off in between assignments while you're on assignment within reason. But one of the biggest complaints is the fact that that time off is not paid. This is where Delta comes in, something called a reward day, where after every 13-week assignment, we will reward you with 1 8-hour day of PTO. We also do something called a career reward day, which is basically the same thing, but it's after every fourth 13-week assignment. If you work 4 13-week assignments in a year, you will end the year with 5 8-hour days of PTO, 4 reward days for 4 different contracts, and then a career reward day for that fourth 13-week contract. So I know while you're looking to get into travel therapy, exploring different contracts, you're most of the time still a provider working. So trying to set up interviews and make time for interviews can be tough. I will always ask you what your interview availability is. That way, when I submit you to a job, I submit that information too, and then the clinic is going to work around what your interview availability is. Also, the interviews are anywhere from 15 minutes to 30 minutes. Number five, loneliness. Something that I do as a recruiter, if I have a traveler in a particular area and I'm getting ready to send another traveler to that area, I will make sure both of them are good with me connecting them. That way you have somebody to talk to and it feels a little less scary and it feels a little less lonely. This is the last con on the list. So sometimes it can be hard trying to plan out your year or plan out the next 6 months or while also trying to secure travel contracts. Some recruiters, they'll wait till the last minute and book a traveler a contract a couple weeks before their start date. I give 2 months for different reasons. One, it eases the provider's mind to know, okay, I'm going to be going to this location in 2 months or in a month and a half, and I can now start to plan out the next few months because I know where I'm going to be. Another reason that I like to give 2 months is because it leaves plenty of time for licensing, credentialing, interviews. So those are 6 cons to travel therapy. If those didn't scare you out of the possibility of getting into travel, feel free to hit me up.